If you're over 60 and notice numbness, tingling, or an uncomfortable sensation in your feet or legs, you're not alone. Many older adults experience nerve discomfort and assume it's just a normal part of aging. But in many cases, these sensations are linked to how well nerves are being supported inside the body. As we age, nerves become more sensitive to changes in nutrition, circulation, and daily habits. When nerves don't get what they need, signals slow down and discomfort can quietly appear, often starting in the feet and becoming more noticeable at night or during rest. In this video, we'll talk about one important vitamin that doctors often discuss when supporting nerve comfort after 60. This is not a medication or a quick fix. It works by helping maintain nerve structure and supporting healthy signal transmission over time. You'll learn why nerve discomfort becomes more common with age, how this vitamin supports nerve health safely, and what realistic improvement looks like when nerves receive steady support. If nerve discomfort is affecting your comfort, balance, or confidence, stay with me and learn what your nerves may be missing. Nerve discomfort after 60 often develops slowly and quietly, making it easy to overlook in the early stages. Many people first notice mild tingling, a dull, numb feeling, or reduced sensitivity in the feet and assume it is temporary. In reality, these sensations are often early signs that nerves are no longer receiving the support they need to function efficiently. Nerves act as communication highways between the brain and the rest of the body. When these pathways weaken, messages travel more slowly or become distorted. This is especially noticeable in the feet because they are farthest from the heart and depend heavily on steady circulation and nutrient delivery. As aging progresses, nerve cells become more vulnerable to even small disruptions in their internal environment. One of the most important factors affecting nerve comfort is nutrition. Certain vitamins are essential for maintaining the protective covering around nerves and supporting the chemical processes that allow signals to pass smoothly. When levels of these vitamins decline, nerve insulation can weaken, making nerves more sensitive and less efficient at transmitting information. Over time, this contributes to discomfort, altered sensation, and balance issues. Absorption also becomes less efficient with age. Even when the diet includes adequate nutrients, the body may struggle to absorb and use them effectively. Reduced stomach acid, changes in digestion, and common medications can all interfere with nutrient availability. This means nerve-supporting vitamins may be present in food, but not fully reaching the nerve tissue where they are needed. Circulation plays a supporting role. Nerves rely on blood flow to deliver oxygen and nutrients and remove waste products. After 60, circulation to the lower extremities often slows, limiting how well nerves are nourished. Poor circulation and nutrient gaps frequently occur together, creating conditions where nerve discomfort becomes more noticeable. Daily habits can quietly influence nerve health. Long periods of sitting, limited movement, dehydration, and inconsistent routines reduce circulation and nutrient delivery. Stress and poor sleep further increase inflammation, which can irritate sensitive nerve endings. These factors do not cause nerve discomfort overnight, but they gradually weaken nerve function over time. When nerve support improves, changes often appear subtly. People may notice reduced tingling at night, better awareness of foot position, or less sensitivity to temperature changes. These early signs indicate that nerve communication is becoming more stable and efficient. Supporting nerve comfort after 60 is not about overstimulation or aggressive interventions. Aging nerves respond best to steady, gentle support that aligns with the body's natural repair processes. Consistency matters more than quick results, and small improvements often build gradually as nerves receive the nutrients and conditions they need to function more comfortably. As nerve discomfort becomes more noticeable after 60, many people focus only on the symptoms without understanding the underlying processes that influence nerve health. Nerves are living tissue that require constant internal support to maintain their structure and function. When this support weakens, nerves become more sensitive, signals slow down, and uncomfortable sensations such as tingling or numbness can appear, especially in the feet. One key factor is the way aging affects nerve energy production. Nerve cells need a steady supply of energy to send electrical signals efficiently. As vitamin levels decline, nerve cells struggle to maintain this energy balance. This often explains why nerve discomfort feels worse during rest or at night, when circulation naturally slows and nerves rely more heavily on internal reserves. Inflammation also plays a role. Low-grade inflammation becomes more common with age and can irritate nerve endings, making them more reactive to minor stimuli. This irritation does not always cause pain, but it can dull sensation or create a persistent uncomfortable feeling. Supporting the body's ability to manage inflammation helps calm nerve activity and improve comfort. Another often overlooked issue is how medications affect nerve nutrition. Many commonly prescribed medications interfere with vitamin absorption or increase nutrient loss over time. While these medications may be necessary, they can unintentionally contribute to nutritional gaps that affect nerve function. This makes consistent nutritional support even more important for older adults. Blood sugar regulation influences nerve comfort as well. Even in individuals without diabetes, fluctuating blood sugar levels can stress nerve cells and worsen discomfort. Certain vitamins help support stable metabolic processes, reducing stress on nerves and promoting more consistent signaling. This can make sensations in the feet feel steadier and more predictable. Hydration also affects nerve health. Dehydration slightly thickens the blood, slowing nutrient delivery and making nerve tissue more sensitive. Many seniors reduce fluid intake to avoid frequent bathroom visits, but this habit can worsen nerve discomfort by limiting circulation efficiency. Steady hydration supports smoother nutrient transport to nerve endings. Movement works together with nutrition to support nerve comfort. Gentle daily movement improves circulation and reinforces nerve signaling pathways. Without movement, even adequate vitamin intake may not reach nerve tissue effectively. Simple activities such as walking, ankle rotations, and foot stretches help keep communication pathways active. Progress in nerve comfort is usually gradual. Early changes may include fewer nighttime sensations, improved balance awareness, or reduced sensitivity when standing or walking. These subtle shifts indicate that nerve signaling is becoming more stable. Understanding how energy production, inflammation, absorption, and circulation interact helps explain why targeted vitamin support can play a meaningful role in supporting nerve comfort and sensation in numb feet. Circulation plays a critical role in how nerves feel and function after 60, especially in the feet. Nerves depend on steady blood flow to receive oxygen, vitamins, and other nutrients needed for clear signal transmission. When circulation slows with age, nerves are often the first tissues to show signs of stress. This is why numbness and reduced sensation frequently begin in the toes and gradually spread upward. As blood flow becomes less efficient, nerve endings receive fewer resources and struggle to maintain normal communication with the brain. Signals may arrive late, weakened, or incomplete, creating sensations such as heaviness, tingling, or dull numbness. These changes are not sudden, but develop quietly over time as circulation declines. Reduced circulation is often linked to decreased muscle activity. The muscles in the legs and calves act as a natural pump that pushes blood upward against gravity. When movement decreases, this pumping mechanism weakens, allowing blood to pool in the lower legs and feet. This pooling limits nutrient delivery and slows waste removal, creating an environment where nerves become more sensitive and less responsive. Daily posture also affects nerve comfort. Sitting for long periods, crossing the legs, or keeping the feet in one position for extended time can restrict blood flow. Over time, this restriction compounds circulation issues and contributes to nerve discomfort. Simple changes such as shifting positions regularly or standing briefly throughout the day help maintain healthier circulation patterns. Hydration influences circulation as well. When the body is underhydrated, blood becomes slightly thicker, making it harder to deliver nutrients efficiently to nerve tissue. Many older adults unintentionally reduce fluid intake, which further limits circulation and increases nerve sensitivity. Maintaining steady hydration supports smoother blood flow and better nerve nourishment. Inflammation adds another layer of stress. Chronic low-grade inflammation affects blood vessels, reducing their ability to expand and contract properly. When blood vessels lose flexibility, circulation to the nerves becomes less efficient. Supporting vascular health helps improve the delivery of nerve-supporting vitamins and oxygen. Movement does not need to be intense to support nerve comfort. Gentle activities such as walking, ankle circles, toe movements, and light stretching activate circulation without placing strain on joints. These movements help deliver nutrients to nerve endings and reinforce communication pathways between the feet and the brain. Vitamin support becomes more effective when circulation improves. Nutrients cannot benefit nerve tissue if they cannot reach it. When blood flow increases, vitamins are better absorbed by nerve cells, allowing them to support signal transmission more efficiently. Early improvements linked to better circulation may include warmer feet, improved awareness of foot position, or reduced nighttime tingling. These signs indicate that nerves are receiving more consistent input and responding with clearer communication. Understanding the relationship between circulation and nerve comfort helps explain why addressing blood flow alongside nutritional support is essential for improving sensation and stability in numb feet after. Many seniors focus on supplements alone when trying to improve nerve comfort, but daily habits often determine whether nerves actually respond. After 60, nerves become more sensitive to stressors that may have been harmless earlier in life. Small routine choices can either support nerve stability or quietly worsen discomfort over time. One common issue is prolonged sitting. Sitting for long hours reduces circulation to the lower body and compresses nerves in the hips and legs. When this becomes a daily pattern, nerves receive less oxygen and fewer nutrients, increasing the likelihood of numbness or tingling in the feet. Breaking up sitting time with short periods of standing or gentle movement helps maintain healthier nerve signaling. Footwear also plays an important role. Tight shoes, narrow toe boxes, or firm socks can compress nerves and blood vessels, limiting circulation. Over time, this repeated pressure irritates nerve endings and reduces sensory feedback. Comfortable shoes that allow natural foot movement support healthier nerve communication and reduce unnecessary stress on nerve tissue. Sleep quality directly affects nerve comfort. During deep sleep, the body reduces inflammation and focuses on tissue repair. Poor or fragmented sleep interrupts this process, leaving nerves more reactive and sensitive. Many seniors experience lighter sleep cycles, which can contribute to increased nighttime tingling or discomfort. Establishing a consistent sleep routine helps create better conditions for nerve recovery. Stress is another often underestimated factor. Chronic stress increases inflammatory chemicals in the body, which can irritate nerves and disrupt signal transmission. Emotional tension frequently shows up physically, especially in sensitive nerve tissue. Relaxation practices, slower pacing, and calm daily rhythms help reduce this internal strain. Hydration habits quietly influence nerve health as well. Inadequate fluid intake thickens the blood slightly, making it harder for nutrients to reach nerve endings. Seniors often limit fluids to avoid nighttime bathroom trips, but this habit can worsen nerve discomfort. Balanced hydration throughout the day supports smoother circulation without overwhelming the system. Nutrition timing matters in addition to nutrition content. Skipping meals or eating irregularly can cause fluctuations in blood sugar, which stresses nerve cells. Even in non-diabetic individuals, unstable blood sugar levels can worsen nerve sensitive. Regular balanced meals help maintain a stable internal environment for nerve function. Medication interactions also deserve attention. Some common prescriptions reduce vitamin absorption or increase nutrient loss. This does not mean medications are harmful, but it does mean nerve supporting habits become more important. Coordinating supplements with meals and maintaining consistency helps reduce these effects. Early improvements from lifestyle adjustments are often subtle. People may notice less nighttime discomfort, improved awareness of foot position, or fewer sudden tingling sensations. These small changes suggest nerves are receiving steadier support and responding with more stable communication. Supporting nerve comfort after 60 is rarely about one dramatic change. It is the accumulation of small, consistent habits that protect nerve tissue, reduce irritation, and allow vitamins to work more effectively within the nervous system. Long-term nerve comfort after 60 depends on creating an environment where nerves can remain stable and supported day after day. Vitamins play an important role, but their benefits are strongest when paired with routines that reduce stress on the nervous system and allow gradual repair. Aging nerves do not respond well to sudden changes or aggressive approaches. They respond best to steady, predictable support. Consistency is one of the most important factors. Taking nerve-supporting vitamins at the same time each day helps maintain stable levels in the body. Nerves rely on constant biochemical signals, and irregular intake can interrupt this process. When vitamins are supplied consistently, nerve cells are better able to maintain their protective structures and communication pathways. Daily movement continues to be essential even when sensation is reduced. Gentle walking, ankle movements, and light stretching stimulate circulation and reinforce nerve signaling. These actions help maintain the connection between the feet and the brain. Without regular movement, nerves receive weaker signals and gradually lose responsiveness. Foot care is often overlooked but plays a supportive role. Gentle massage Warm foot baths and avoiding prolonged pressure help reduce irritation around nerve endings. Keeping feet warm improves circulation, which enhances nutrient delivery to nerve tissue. Cold exposure, on the other hand, can temporarily worsen numbness by restricting blood flow. Sleep patterns strongly influence nerve comfort. During restful sleep, the body lowers inflammation and focuses on repair. Inadequate sleep increases nerve sensitivity and slows recovery. Many seniors experience lighter sleep, making nerves more reactive during the day. Establishing calming nighttime routines and consistent sleep time supports healthier nerve function. Mental stress also affects nerve signaling. Chronic worry or tension activates stress hormones that increase inflammation and nerve sensitivity. Even when physical habits are well managed, ongoing emotional stress can worsen numbness or tingling. Relaxation practices, slower pacing, and mental calm help reduce this burden on the nervous system. Hydration supports all of these processes. Proper fluid balance helps blood flow smoothly, allowing nutrients to reach nerve endings efficiently. Dehydration reduces circulation quality and increases nerve sensitivity. Drinking fluids steadily throughout the day supports nerve comfort without overwhelming the body. Expectations matter as well. Nerves heal slowly and improvements often appear gradually. Early changes may include fewer nighttime sensations, improved balance awareness, or reduced heaviness in the feet. These signs indicate stabilization, not instant reversal. Understanding this timeline helps maintain patience and consistency. When vitamins, movement, sleep, hydration, and stress management work together, nerves are more likely to remain comfortable and responsive. This combined approach supports clearer sensations, steadier balance, and greater confidence in daily movement for people over